Happen, the stress levels has gone up really crazy. There is no specific time that you're working. One second is you're all the time on a high pressure explosion on information. It took me almost few weeks to tell her that it is not a major illness. It is very strong, it's very intense, at the same time it's a very very funny thing. So the type of eating has completely gone topsy-turvy. Constant change in your lifestyle, you're constantly being stressed by your office. Every body is unique and it has a mensurating cycle on its own. There are right and wrong, think about it, balance yourself, you give everything, but never unconditionally for wrong things support your child.
Dr. Amudha Hari, it's so amazing to have you with me in my studio today. Um, I've been admiring your work for the last 5 years, and I've known you for the past 7 years. Your work with Mitra's Foundation, the work that you do with underprivileged children and women, and the experience that you bring on board with over 25 years of experience and in-depth knowledge in infertility and women's health. It's just something that I had to showcase, and it's really a privilege that you're here today with me.
Thank you, Rashmi. It's been always a pleasure to talk to you. More so when you're in your studio. I'm very happy to be here.
Thank you, ma'am. Ma'am, to start with, I really want to, in the last 5 years, I'm observing that there's been an explosion of infertility clinics. Anywhere you go, where this topic was unheard of when I was a child. Today, it's commercialized. Every day morning on the radio, I hear ads for infertility clinics. I mean, what is happening? What is going on? Like, what's going wrong?
Point well taken, Rashmi. Let us say 10 years back when we are practicing, or 15 years back, I have a full week's OP. There used to be only 1 or 2, 3 patients of fertility issues and coming. Today it is completely 360-degree change. All young people have some or other fertility issue, except for a 30-40% who are not having any issue. There are young people, and so fertility issues are on the rise. So that naturally the need for having an IVF clinics and fertility centers are becoming more.
But what is the reason, ma'am?
See, there are just not one single reason. There are multiple reasons for this issue. For example, these days youngsters, no, right? Let us possibly put it as social, personal, and also other physical reasons. Like when you come on a personal level, most of these people, whether they are an IT or a non-IT job, they are on call all the time. They are with some sort of a mobile, laptops, and they are communicating all the time, and more so with the job. So what happens is there is no timeline between the job and not you're going home and relaxing like that. Even at home at 10 o'clock you have an official call. Okay, this one. And what happened? The stress levels has gone up really crazy because there is no specific time that you are working. One second is you're all the time on a high pressure. You are given targets and you are bombarded with some sort of a work. Another most important factor is explosion on information. Let me just take one small example. I had one patient, one young girl about 20 plus, walking in with some period irregularity. As a routine, when I saw her, I gave her a request for an ultrasound, which is a part of the protocol. The next day, when I'm operating, I'm getting a call every 5 minutes from that girl saying, I need to see you, I need to see you. Then I thought, okay, possibly there has to be some, they have picked up some cancer, some tumor. That's why she's so worked up. So I told her, okay, she couldn't wait. I said, okay, come to the theater. So she came and I saw the report. It simply said polycystic ovary. I said, what is the issue, ma? Why are you so worried? She started crying. You could make out she hasn't slept the whole night. I asked her, what is the reason? It's a simple report of you do have a polycystic ovary. But what is the hue and cry about? She's saying, madam, I saw the whole thing in Google. I know now I am not going to have a child. my married life is going to be terrible. I said, who said all this? She said, yes, I read the whole night about polycystic ovary. She seemed to have mastered it. See what happens. The point to be taken here is when you have too much of information and you don't have the knowledge to discriminate it, the only outcome is anxiety. The only outcome is anxiety. Because they start thinking, okay, I'm not going to have a child, my marriage is going to be bonkers. So she thought, okay, I'm done with. Because she doesn't know what is poly. I simply said, see, come on, you're going to take an ultrasound for a woman of your age. If I send 10 requests, at least 4 to 5 might have a polycystic ovary. Why are you getting worried? It took me almost few weeks to tell her that it is not a major illness. Because our mind is a very funny thing. It is very strong, it's very intense. At the same time, it's a very, very funny thing. It takes in, human mind takes in all negative information, fat. Okay. If you tell them some positive thing that this is what you need to do, let's say you need to exercise, it doesn't take in. But if you're going to have a cancer, yeah, it immediately picks up. So when you have this negative input constantly about the health, it becomes a problem. So when you start, people might think what knowledge is so important. So when I am able to look into Google and understand what I have, why should doctors speak like this? No, it is not true. You can look into Google, but do you know where to stop? You don't know where to stop. So that what happens, you start reading, and something of no value, something of very, very simple thing, you start getting very worried, and that starts a whole cycle of a stress. So like this increased stress, our eating habits. I don't have to start again. Now the eating habits are completely different from earlier 10 to 15 years back. Now you have, I just want something, I just need to call a Swiggy and order it. So there is no, like otherwise earlier, I want a sweet, I need to either make it or make an effort to go out and buy it, which is difficult. I'm not going to do it every day. But let us say I love biryani and I keep calling daily and having a biryani, which is very feasible today. So the type of eating has completely gone topsy-turvy. So you want to eat in the middle of the night, you want to go for it's once in a while is okay. But you have a constant change in the eating habits, constant change in your lifestyle. You are constantly being stressed by your office or your own self. Let us take another example. I have one young woman walking in. She's just married few years, let us say 2 to 3 years. I'm not very sure now. But she said, madam, the next year, January, I want to conceive. Possibly by November or next 10 months, I would like to deliver, because the year after, I'm planning to go abroad. I simply said, please stop. You cannot, this is not your project. You cannot plan like this. You might conceive, you might not conceive. Let us say this woman doesn't conceive by January. What happens to her? She's highly stressed. So health is not like your project where I put in all my blanks and simply say this is where I will conceive, this is where I will deliver. No, you cannot do it. So there are certain things in life you can organize and see it happens accordingly. Also there are certain things in life you take it along the flow. You enjoy the life. That's what whenever an young couple come in and say, we are married 3 months, we would like to take a consult for fertility. I said, please, fertility, any investigation for fertility, you need to wait minimum 12 months of being together without contraception, and let the body, you have to give the time to the body to see and work out the probability. You enjoy your married life. Why should you immediately on the 3rd month say, no, I think I have a fertility issue, let me come for this counseling, that counseling. All this puts a lot of stress. So now we have talked about the official office stress, about the way you're eating, about less of physical activity. This is vitamin D deficiency we are finding left, right and center. Why? Because you're not going for your regular activity. Most of the young people sleep late. Most, I'm not telling everyone, but most of them sleep late. That's because they sleep late, they get up late. Now, where are they looking into that early morning sun? No. Then Second is you are jumping from one AC office into an AC car or into your AC bedroom. Then where is your exposure to the vitamin D? Your son, you're not getting it. So slowly the deficiency starts building, except for few young people who are very, very conscious about their diet, about their physical activity, about what they think. The third most important thing which I think which raises the problems of fertility is your mental attitude. You're all the time anxious. You're all the time goal oriented. I am trying for a baby. It's not happening. Gone. I'm extremely anxious. How long you've been trying for the baby? I've been trying madam, I'm married 3 years. Okay, fine. How long you're trying? Okay, married 3 years is a different thing. How long you're trying really for a baby without contraception? Madam, first year he was outside India. Second year, I was outside India. Now, the last 3 to 4 months, we are really trying and it's not happening. What to say? I simply said that means you're literally married for only 3 to 4 months. So why put in so much of a mental pressure here? That's because I started trying. Now every other cycle becomes a big stress on me. There is no let go. Most of the youngsters, there is no let go. They don't want to take the flow. Particularly, that's what I keep saying. I have even had couples, young couples, who are come in and said, Madam, we have come here to consult you and we are all set for a in vitro fertilization. That is IVF pregnancy. Because we have tried for the last 1.5 years, nothing much happens. I said, then we rework the whole thing. We'll give them what are the things they have not done. And so many times, believe me, I'm not exaggerating when I say so many times, they have conceived naturally. When we clear the deficiency, we mentally let them relax and say, these are the few tips for you to conceive naturally. Please try it first before you jump into IVF. And let me say, just not 50%, more than 70% have conceived naturally when this happens. So ultimately, all these multiple factors make them feel, the fertility issues keeps on getting either exaggerated or it is also there. Of course, premature ovarian failure, PCOS, endometriosis, and for male, the motility issues, the sperm count, all there are raises in these issues. I'm not saying no. That could be because, as I said, of all the mental and the physical factors, like food, like how you're all the time anxious, all this could and has an impact on the raising physical issues.
Ma'am, this is very interesting because I was just having a conversation with a colleague whose brother and sister in law have been married for a year and a half. Now, apparently, the family is very worried that they're not going to be able to have child from the elder brother because it's been a year. So, at what stage? This kind of environment itself is so stressful. I'm sure the girl would be now thinking that she cannot conceive. The couple must be thinking that they cannot conceive, which may not be true. So, at what stage should a couple seek for medical intervention and advice on?
It's a very, very pertinent question because so many times we see young couple walking in the 3rd month, 4th month, 5th month, or less than a year, and saying that we are worried, we would like to have a counseling, we would like to have a testing, we would like to even go for a therapy. Not just a counseling. Yes, preconceptional counseling is excellent. That means you are very well aware of so many X, Y, and Z. It is not simple as that. They want to have therapy before 1 year. So the first, by definition, infertility means you are together, a man and woman in a physical relationship without contraception are together for minimum 12 months and they are not able to conceive. That is the time they need to go for a consult and not before. Let us say, no, I am married itself, I am 36 years, now how long to wait? Okay, then possibly 6 to 7 months of whatever we say, no contraception, being together. Not that you are in Bombay and he is in London. It's not like that. When you are together and you are physically together and not using contraception, then the second thing with fertility, it is not a issue for only the couple. It is a family issue. Now, all the time you see the family, the mother, it doesn't have to be just the mother in law. It can be the mother, it can be the mother in law or the family bringing the women and saying, please check her and see whether she is fertile, whether she will be able to conceive, whether we will be able to have a grandchild. Why only the women? Why, you mean to say that your son or your son in law is all right? When it comes to fertility, you must always have the 50% possibility or responsibility is with the male and 50% is with the female. So you cannot just bring a woman and say she has irregular cycles. First, we would like to correct it. That is another myth. What is a correction of, let us say this woman has been mensurating only 30 days once or 40 days once. Suddenly you think by making it 28 days she is going to conceive. That itself, that you can regularize your periods to monthly once is a myth. Every body is unique and it has a menstruating cycle on its own. Like some women are, let us say 50 to 60% or 28 to 30 day cycle, but the rest can be 30 days, 45 days, even 2 months once. All this is okay, it's correct. So when you are going to a fertility therapy, we might have to modulate it here and there so that you ovulate on time and you conceive. But otherwise, the this myth of I want to correct my irregular cycles and then only I will conceive is not true. Another thing is, all the time, it is not just one single time, all the time women are brought first. And let me put it even one step further. It is the women, when the wife, I say, why don't you bring your husband? She says, no, I will go through the therapy first. Then I will request my husband to come. It is not only about the mother and mother-in-law. It is the woman herself feels that she needs to be checked first. These are all social things which has impacted our women's psyche so much that they think they have to be first tested and they have to be treated, and then only the husbands, when they really have no other options left, the husband walk in. It is most of the time. But properly speaking, for a fertility therapy, it has to be the husband and wife, which, okay, now it is 1 year, 2 year, we have done everything, whatever we need to do, and still we have not conceived. Then they have to decide, this is a time I am going for a regular medical consult. Now, when I am going for a medical consult, we must be going together. You choose, you look into different, now everything is available. Like once again, even doctors and hospitals are getting reviews and people are looking into it and going. That's a fact. So you see who you feel you can trust and go. And please, once you've decided, trust. Every part of the treatment you cannot say why they are doing this, why they are doing this. No. You choose the person correct, and then please trust the medical or a healthcare professional to do their best for you. So you choose a doctor or a center or whatever you want, and then go for a checkup. Please go together, both the husband and wife, and you have to go through the therapy also together, because as I said earlier, a very simple corrections. It could be in the way they are together, or it could be a deficiency. It could be a simple thyroid problem. If it is corrected, they can conceive. So please go together and have the first line discussion with your gynecologist or a healthcare provider, and then decide how you want to take it. Just don't go by your ads and fertilities and your pressures, particularly family pressure. You must have a child. Your sister who got married later than you has a child now. This is another thing. My friend who got married has a child now. My sister has got a child now. I am married a year before and I am still not able to conceive. You're not on a race. Everybody is very, very unique. So you have to give your time. The therapy has to be focused on you, not because someone has a child earlier.
Ma'am, so supposing a husband and wife has now come to you. Now, what is the process of preparation in order to conceive?
Let us say the couple have decided, I have chose a doctor and they have come for a consult. First will be we go in depth about history taking. about understanding where is the problem, whether the problem is physical or the problem is just the pressure, or if there is any deficiency. So the first, when the couple walks in, it will be general history taking to the understanding. For example, let us go with an example so that you understand better. Like an obese patient who is 100 plus kgs also find it difficult. At the same time, patient who is less than 40, 35 kgs will also find it difficult. And at the same time, I am on some medication for something. Let us say I'm a very I'm very anxious and I'm on some antidepressants, and they can find it difficult to conceive because of medication, because of so many patterns in there. So history taking plays first a very very vital role. Like I said, I'm married 5 years, but I'm together only 3 months. So just by understanding that, see, when you look at it from outside, what they will say, they're married 5 years and they still don't have a child. But which is not true. I'm on contraceptive for the 4.5 years. Now only I left the contraceptive and I am trying to conceive. Now where is the question of pushing them into IVF because they are 5 years? There is another couple who's married 5 years but been trying very intensely for the 4 years without contraception, and they have done all the tricks, all the tips, they have used all the tips and they have tried all the tricks. That therapy is different. So understanding what is the problem of that particular couple really really becomes very important. So history taking plays a very important role. Second is general examination. Like I said, thyroid problem, obesity, could be anything as simple as that vitamin D deficiency, or someone my lifestyle. So history taking, second thing is you understand where exactly the gap lies. So you go through all the investigation. Now for women there is one set of investigation, for male there is another set of investigation. Women, you understand whether they are ovulating, whether their hormone profiles are normal, whether the ultrasound is normal, the uterus and the ovaries looks in an ultrasound normal, or is there any issue. And for a male, you are doing a semen analysis. Semen analysis shows them whether the count is okay, whether the motility is okay, whether there are any other infections present in the semen. And of course, there are other tests like also, you must not think that only semen analysis is important for a male. For him also general exam. For example, the husband can have a vitamin D deficiency. The husband can have thyroid problems. So many things. So a detailed history taking, a detailed investigation for general problems. I'm not talking about reproductive problems. About general problems is very, very important. Followed by your reproductive. Then you talking about ovaries and their hormones, uterus and their positions and the hormones, and for male also same, semen analysis and DNA fragmentation. There are tests like that which shows not just the count and motility, also the quality of the sperms. So when we have all the investigation on the table, the first few things are there, we start working on it.
Doctor, if there are two things that you would say that a couple undergoing infertility management should not do, what are those two things?
Yeah, it's also a very interesting question, because one common mistake what I see most of these couple, at least fairly a 50% of them do is, I go to one doctor, start the therapy, then I'm become restless because I'm not conceived. This 2 months, 3 months, 4 months, nothing much has happened. 6 months, I change my doctor, I change my therapy. And see what happens, the second doctor starts all over again. You do the same test, same understanding, and start on the same therapy. Another 2 months, then someone else, one of my friends suggests, one of my mother suggests, one of my colleagues suggests, I go to another doctor. Please don't do it, because you are not stepping up your treatment. You are redoing certain things again and again and again. It's not going to be of a great benefit to you. Second is, I have no patience. I'm married 3 years. I've been trying 2 years. Let me do my, not even IUI. I am willing to go for an IVF. I will jump up all my protocols and go for an IVF. Because I think there is a difficulty. I don't think I'm going to conceive faster. Let us go to IVF. The problem in such things is, if you do the IVF, is it 100% you're going to have a child? We are not sure. Might your percentage have increased, but it's not 100%. So when you have a failure with IVF, you're all the more shattered. So never as a couple keep on changing your healthcare provider. Never as a couple jump up your practices and go for IVF. Always decide on treatment, go step by step. Success is yours.
Doctor, now, our discussion, we've covered the point about how there's an explosive need for infertility clinics. What can young educated parents do today to make sure that their children do not get into the cycle of infertility in a period of, say, 10 years?
Of all the questions, this is the most interesting question because always prevention is better than cure. Now I have this problem racing and racing. Now I have my child, let it be a female child or a male child, how much I can see that she doesn't have this issue. Right from the beginning, right type of food, or awareness about what to eat, what not to eat. And just because you are feeling very lazy, you are not giving biscuits, you are not giving pizzas, you are not giving pizza, not once in a while, all the time. You feel you are indulging your child and giving wrong foods. No, you are teaching them the importance of having a good lifestyle. For example, simple exercises for 15 minutes, going out in the sun, playing in the suns, not video game all the time. No, you have to play physically. So, lifestyle changes, and also give them the liberty to think for themselves. Give them the mental, you be supportive. Say, whatever you do, I am there for you. Or whatever you do, there are right and wrong, think about it, balance yourself. You give everything, but never unconditionally for wrong things support your child. What happens, they all build up unnecessary pressure. And when your child is joining school, like how you say, no, you must get first rank, what happens, the child becomes extremely either competitive or extremely very stressed that I need to do it. That is why if I don't do it, I'm a failure. Don't teach this mental attitude to your child. So, having a right type of food, exercise, physically being active, and having a good mental health goes a long way.
This is very interesting, ma'am, because I think today's parents are not allowing their child to fail. Their need to protect their child is so much, so driven that they correct the child before the child makes a mistake. But the mistakes will happen in life, right? It's better to have mistakes when you're in the comfort of your home with your own parents. So yeah, that's a very pertinent point that you made.
If I down, I'll get up. But I don't know how to fall, and I am in the fear of falling all the time. It's definitely not an interesting mental attitude. So, you might think why mental attitude is so important when I'm physically fit. It does make a lot of difference and lot of impact on your health.
Thank you, ma'am. Thank you. Thank you so much for this conversation. And I am 100% sure that this is going to be helpful for so many young people out there who will be watching this conversation. Thank you so much.
Thank you, Rashmi. It's been a pleasure.